Anne is demonstrating that this is a stool on rockers which goes fairly easily from side to side. She's demonstrating the need to re-establish balance through a symmetrical body, in other words, both sides of the body, and stop. We find this a very useful piece of furniture, particularly where the patient has difficulty in transferring over the affected side, and that applies to most stroke patients. Bring your hand round, look round this way, and rock. And take your hand back and rock from side to side. That wouldn't be achieved at once. We'd have to start all our stabilizings, come over here and stay. I can hold the stool with my foot on the rocker and get the position I want. Particularly if she doesn't want to transfer, I'll be encouraging her. Put your hand back again and go back into rocking. And again, the small hand splint is maintaining the position on a non-slip mat. The other rocking machine that we use is a rocking chair. The patient sits with her feet on a raised footstool, and the height of the footstool depends on the length of her tibias, because we must make sure she's rocking on heels and not on the forepart of her foot where she brings in the unwanted extension pattern. There is a very nice leg pattern, and she's weight-bearing on the heel and doing very good therapeutic exercise for the leg. But what about the arm while she's doing that? This is our chance to show you how to put on an arm splint with the patient in sitting. But first I should say it is best to apply the splint with the patient in lying, as already described. But it isn't always convenient to pop the patient into lying while you put the splint on. So we teach them to do this. First of all, we put a pillow in to help maintain the arm position and to elongate the trunk. And we make quite sure that we've got the good hip pattern there. And then, because sitting is a total flexion pattern and it would put the arm also into flexion, we try to help the distribution of tone in the forearm by asking them to drop their head back so that the neck goes into extension and to rotate, which brings in the tonic neck influence that really helps give us extension in the forearm. And in this position, we're ready to apply the splint. Now I'm going to apply it, and there are one or two finer points about the use of this splint which we haven't made earlier and which Anne will now show.
It's very important that these splints be inflated by mouth, because the warm, moist air from the therapist's lungs makes the sleeve of the splint move and conform to the patient's limb, ensuring that the pressure is all over and even. The pressure is the same as that of the lung pressure of the therapist, and this will do no tissue damage to your patient.